Imagine a world where patients suffering from chronic pain, severe nausea, or debilitating neurological conditions have safe, legal access to a treatment that could potentially improve their quality of life. This is not a distant dream, but a potential reality if the US federal government legalizes cannabis for medicinal use. Despite increasing state level legalization, cannabis remains illegal federally, depriving countless individuals of its medicinal benefits. It's time to change this and fully legalize cannabis nationwide. We have all seen or heard about peers who use cannabis for medicinal reasons, often struggling with inconsistent state laws and the stigma attached with it. There are friends, families, classmates, and sometimes even family members who could benefit from a more consistent and scientifically backed approach to cannabis use. As a college student, I'm deeply aware of the importance of public health and the policies that impact our communities. Today, I want to discuss an issue that is not only timely, but also critical to the well being of countless individuals across our nation: the federal legalization of cannabis. Today, we will go over the need for the federal legalization of cannabis, statistical benefits of the use of cannabis, a solution to how we can make the federal legalization of cannabis a reality, and a call to action and how we can make an effort towards the federal legalization of cannabis. The need for federal legalization of cannabis for medicinal use is urgent and supported by compelling statistics. According to the National Institutes of Health, over 3 million Americans currently use medicinal cannabis to manage symptoms related to chronic pain, cancer, multiple sclerosis, and other serious conditions. Despite its effectiveness, these patients often face legal and logistical barriers due to federal prohibition. A study published in the Journal of Pain found that 62% of patients using cannabis for pain management reported a significant reduction in pain, compared to only 25% who experienced similar relief with traditional treatments. The Marijuana Policy Project estimates that legalizing medicinal cannabis federally could save the U.S. government up to $7 billion annually in law enforcement and criminal justice costs associated with cannabis prohibition. A Gallup poll in 2023 revealed that 91% of Americans support legalizing cannabis, highlighting a significant public demand for change that the federal government has yet to address. After considering the extensive evidence and the numerous benefits, it's evident that the next logical step is clear. The U.S. should federally legalize cannabis for medicinal use. Here's how this policy change can be effectively implemented and its benefits realized. Federal legalization would establish a regulated framework for cannabis distribution, ensuring quality control and safe access for patients. This includes establishing guidelines for dosing, purity, and labeling to protect patient health. Legalization would enable patients to use their health insurance to cover medicinal cannabis, making it more affordable and accessible. Currently, many patients have to pay out of pocket, which can be expensive. Federal legalization would facilitate further research into the medicinal benefits of cannabis, leading to new treatments and a better understanding of its efficacy. Legal restrictions and limited funding currently hinder this research. Legalizing medicinal cannabis would create new jobs in the industry, stimulate economic growth, and reduce the financial burden on the criminal justice system. This economic boost would contribute to overall national prosperity. Now, let's imagine a future where patients suffering from severe conditions can access cannabis legally and safely, experiencing significant relief from symptoms and improved quality of life. This will reduce reliance on potentially addictive opioids and other medications with severe side effects. With federal legalization, law enforcement can focus on more pressing issues, leading to a more efficient use of resources and a reduction in unnecessary legal proceedings related to cannabis. The cannabis industry would generate significant revenue, create jobs, and contribute to local and national economies. Savings from reduced law enforcement and criminal justice costs can be redirected to other critical areas such as education and healthcare. Expanded research opportunities would lead to new medical breakthroughs and more effective treatments, further advancing healthcare and patient care. It's time to act and ensure that the U.S. federal government legalizes cannabis for medicinal use. Here's how you can help make this change a reality. Advocate for policy change. Contact your legislators and express your support for the federal legalization of medicinal cannabis. Encourage them to sponsor or support bills that promote this cause. Craft thoughtful and persuasive letters or emails to your elected representatives expressing your support for the federal legalization of medicinal cannabis. Highlight personal stories or data demonstrating this change's benefits and necessity. Raise awareness. Educate your community about the benefits of medicinal cannabis and the need for federal legalization. Use social media, participate in local events, and engage in discussions to build support. Support relevant organizations. Contribute to and support organizations that advocate for cannabis legalization and research. Your support can help drive the necessary changes at the federal level. Vote. Support candidates who champion the cause of federal legalization of medicinal cannabis. Research candidates' positions on cannabis legalization. Voting for policy makers who align with your views is a crucial step in enacting meaningful change. In conclusion, the federal legalization of cannabis for medicinal use is a necessary and beneficial policy change. The statistics reveal that significant medical, economic, and social benefits of legalization. Medical students have shown that cannabis can effectively treat a wide range of conditions, leading to improved patient outcomes and quality of life. Economically, states that have legalized medicinal cannabis have seen substantial growth, with increased tax revenues and job creation. Socially, legislation can reduce the burden on our legal system, allowing law enforcement to focus on more serious crimes and reducing the costs associated with cannabis-related arrests and incarcerations. By taking action now, we can ensure that patients across the country have access to the treatments they need, regardless of their state of residence. This move towards federal legalization is not just about medicine. It's about fairness, justice, and creating a more effective healthcare system for all. Let us advocate for this change and work together to build a healthier, more equitable future.